Welcome to the deep dive. Today we're tackling something, well, absolutely vital. Being truly prepared for health emergencies. We've pulled together some really powerful resources. We're talking global standards from Joint Commission International, practical advice from ready.gov, local guides too.
And insights from Supreme Medic Consultancy, right?
Yeah.
Including some really crucial do's and don'ts.
Exactly. So our mission here in this deep dive is basically to boil all this down into steps you can actually take. Things that can make a real difference when, every second counts for you and your family.
Absolutely. And what's interesting is how these sources come at it from slightly different angles, but they all fit together.
How so?
Well, you've got organizations like JCI or NABH working at the system level, right? Making sure hospitals are ready.
Okay.
Then you have ready.gov, which is much more about empowering you, the individual, your household.
Got it. So we're looking at how those different layers kind of connect.
Precisely. And what that means for you in a practical sense.
Okay, let's unpack this. A core theme that just jumps out from everything is, well, being proactive. It's fundamental.
Definitely.
JCI talks about zero harm, highly reliable care. That implies you've got to be prepared before anything happens, right? It's baked in.
That reliability depends on preparedness long before someone hits the emergency room.
And ready.gov, they're very direct. They say you might need to survive on your own for several days.
Yeah.
That really shifts your thinking, doesn't it? You can't just wait for help to arrive immediately.
Waiting isn't really an option, no.
Ugh.
It's about self-sufficiency initially.
What strikes me here is that convergence you mentioned. Whether it's like a big accreditation body aiming for highly reliable care delivery in a hospital,
Which involves detailed emergency plans.
or ready.gov telling you to stock up on supplies. The core idea is the same. Preparation equals resilience.
It really is. And that Weston MA guide, it makes it tangible with the Go Kit idea.
Ah, the Go Kit.
It's a reminder that prep is active, something you do now, not when things are chaotic.
And it's interesting how this isn't just for individuals. Hospitals, healthcare facilities, they operate this way too.
They have to.
You mentioned NABH setting up accreditation and Supreme Medic helping hospitals get ready, navigate those standards. It's like a whole system of readiness.
Exactly. Think about it, these accreditors, the consultants, they're working to build preparedness into the healthcare infrastructure itself.
So things like backup power.
Backup power, infection control protocols for, say, a public health crisis. It's all part of institutional readiness.
Which complements what we do individually.
Perfectly. The two sides support each other.
Okay, message received loud and clear. Preparation is absolutely key. So let's get practical. Building that emergency kit. Ready.gov has a pretty solid checklist.
It's a great starting point.
They talk about the absolute essentials. Water first. A gallon per person per day.
Which sounds like a lot, doesn't it?
It really does. But it shows how critical hydration is when, taps might not work.
Absolutely. Then non-perishable food, obviously. A battery-powered or hand crank radio.
To stay informed if power and internet are out.
Crucial. A good flashlight first aid kit. These seem basic, but how many of us actually have this stuff gathered in one place, ready to go?
That's the real question, isn't it?
And the insight here isn't just the list. It's the principle behind it. In those first hours, maybe days, you are your own first responder.
Right. Changes the mindset. From waiting for help to being actively involved in your own safety.
Exactly.
Yeah.
Ready.gov also mentions storing things in, like plastic bins or duffel bags, easy to grab and carry.
Smart. Practical.
And the list keeps going. Extra batteries always need those.
A whistle.
A whistle! Why a whistle?
To signal for help if you're trapped or can't shout. Dust mask for air quality issues. Plastic sheeting. Duct tape.
For temporary shelter, right.
Moist towelettes for basic hygiene. Wrench or pliers to turn off utilities, maybe? Manual can opener.
Ah, good one. If the power's out.
Local maps, cell phone chargers, backup battery pack. It reminds you of all the basics we rely on that might suddenly disappear. And it doesn't stop there, does it? They talk about adding items based on your specific situation.
This is where the personalization comes in, and it's vital.
Things like prescription meds, absolutely crucial. Non-prescription stuff, too, like pain relievers.
Eyeglasses, contact lens solution, easy to forget, critical if you need them.
Baby supplies, pet supplies. We can't forget the furry family members.
Definitely not. Cash, too. ATMs might be down. Important documents.
Birth certificates, insurance papers, keep them safe and accessible. Maybe copies in the kit.
Good idea. Sleeping bag or warm blanket, change of clothes, fire extinguisher, matches, feminine hygiene items.
Things you really wouldn't want to be without.
The Weston Guide adds some really smart local-level tips, too, like having an old-school corded phone.
Because it doesn't need electricity to work, unlike most cordless ones.
Exactly. Extra cell phone batteries, keeping pet plans integrated, wallet-sized contact list, cash, keeping the car fueled up.
And protecting irreplaceable photos, negatives in a watertight envelope. That's thinking ahead.
It really is. And what stands out is this need for a tailored approach. The basic kit is the foundation.
But your life dictates the extras. Kids, elderly parents, pets, medical needs.
All of that shapes your specific kit. And Ready.gov says review it every year. Update it. Because life changes.
Good point. Needs change. Medications expire.
And they also say have kits in different places. Home, obviously, but also at work.
Enough for 24 hours, they suggest.
And in the car, because emergencies don't always happen when you're conveniently at home.
Right. Okay, so kit sorted, or at least we know how to build one. But just having the stuff isn't enough, is it? You need a plan.
The plan is just as critical as the kit, maybe more so.
Ready.gov has a step-by-step guide for this, too.
Yes, and step one is maybe the most important. Talk about it.
With your family, your household.
Exactly. Have that conversation. How will you get emergency alerts? What's the shelter plan? Stay put or evacuate?
Identify evacuation routes beforehand. Right. Not trying to figure it out during the chaos.
Definitely not. Establish how you'll communicate if you're separated. That's a big one.
Cell networks can get jammed.
Very easily. So having a backup communication plan is key. And review the plan, update the kit based on the plan. It's all connected.
They also really hammer home, considering everyone's specific needs in the household.
Yeah, it's not one size fits all.
Ages matter. Responsibilities, who helps whom. Where does everyone usually go? School, work.
Dietary needs, medical needs, including equipment that might need power, disabilities, languages spoken.
Even cultural or religious factors that might affect your response. And pets. Always pets.
It shows you need a really inclusive plan. Ready.gov mentions creating a personal support network, too. People who can help with specific needs.
Like helping with communication or childcare or medical equipment during a power outage.
Exactly. And agree on a meeting place, somewhere familiar, easy to find, maybe one near home, one further away just in case.
Good thinking.
The Weston Guide adds another great tip. Have an out-of-state contact.
Right, because local lines might be jammed, but calling long distance might work.
That's the idea. Easier to get through. And tell people your plan. Family, friends, neighbors, coworkers.
Creates a wider safety net, doesn't it? People know how to check on each other, how to help.
Builds community resilience.
Yeah.
Everyone knows the plan.
Okay, Kit, plan. Now, let's shift to the moment itself. A medical emergency is happening. What do you actually do?
Right. This is where resources like Supreme Medic's Lifelines Guide come in. They have some really clear do's and don'ts.
And the first do sounds simple, but it's probably the hardest. Stay calm.
Absolutely essential. Take a breath, assess the situation, check the ABC's airway, breathing, circulation, look for obvious bleeding, check consciousness.
Why is that initial calm assessment so critical?
Because panic leads to mistakes, wasted time. That quick assessment, are they breathing, bleeding badly, conscious, gives you the info you need for the next step. Call for help immediately. Know your local emergency number, like 112 in India, 911 in the U.S., 999 in the U.K., whatever it is where you are. Be ready with your location and what's happening.
And if you know first aid,
use it. CPR, controlling bleeding with pressure, recovery position for someone unconscious but breathing. These basics can literally save a life while you wait for professionals.
Supreme Medic also says gather medical info, allergies, meds, history.
Crucial for the paramedics and doctors. And stay with the person. Reassure them and be there to talk to the emergency responders when they arrive.
Makes sense. Okay, what about the don'ts? Equally important, I imagine.
Just as important. First, don't.
Yeah.
Don't panic. Reinforces the do of staying calm.
Don't waste time self-diagnosing.
Yes. Don't go down a rabbit hole online when someone needs urgent help. Call the professionals.
And don't move the person unless you absolutely have to.
Right. Especially if you suspect a neck or spine injury. Only move them if they're in immediate danger where they are or if the emergency operator tells you to.
They also stress not ignoring serious signs. Chest pain, breathing trouble, stroke symptoms.
Facial drooping, arm weakness, speech difficulty, the FAST acronym for stroke, heavy bleeding. These are red flags. Act fast.
And don't give food or drink. That seems counterintuitive sometimes.
Especially if someone is unconscious or might need surgery or is having a stroke or in shock. It can cause choking or other complications. Wait for medical advice on that.
Okay. The Weston Guide adds some local angles too, reinforces some of this. Follow directions from officials.
Crucial in a wider emergency. And have enough of your own medications ready?
Their don'ts include not calling the emergency number unless it's truly life-threatening. Don't tie up the lines.
Right. And specific safety things, like don't eat or drink anything near a chemical spill or unknown explosion. Common sense, but good reminders.
Go to your meeting place after evacuating. Don't go to a shelter without your pets. Important logistical points.
They really covered a lot of practical ground for community-level emergencies.
Supreme Medic also breaks down common medical emergencies and those first actions. Heart attack.
Symptoms like chest pain, shortness of breath, nausea. Call an ambulance right away. Chew an aspirin if not allergic while waiting.
Stroke.
Sudden numbness, confusion, trouble speaking, loss of balance.
Yeah.
Call ambulance immediately. Note the time symptoms started that's critical for treatment. Keep them calm.
Severe allergic reaction, like anaphylaxis.
Swelling. Breathing difficulty. Use an epinephrine auto-injector like an EpiPen if they have one and you know how. Then call emergency services.
Severe bleeding.
Direct pressure. Clean cloth if possible. Keep pressure on.
These are those immediate, potentially life-saving actions while help is on the way.
Exactly. Knowing these basics, recognizing the signs for things like heart attack or stroke, it empowers you to act quickly and correctly. And knowing when something like breathing difficulty or unconsciousness means get to the hospital NIW, no delays.
So bringing this all together as we wrap up this deep dive, the main takeaway is just crystal clear, isn't it? Preparation.
It's everything. It's paramount.
Having that kit tailored to you. Having that plan discussed and understood. Knowing the basic do's and don'ts, it can genuinely change the outcome.
Massively. Staying calm, acting fast, trusting the professionals when they arrive.
And when you think about it, connecting back to JCI's goal of zero harm or Ready.gov's aim for resilient communities, our individual preparedness is a piece of that bigger puzzle.
It absolutely is.
Yeah.
By preparing yourself and your family, you're not just protecting yourselves, you're contributing to a safer, more resilient community overall.
So here's something to think about as we finish. We know the basics are crucial, but with global health challenges seeming more complex and different kinds of emergencies always possible, how can we as individuals and communities push our preparedness even further?
It's an interesting question.
What role does continuous learning play? You know, taking a first aid course, CPR training, maybe joining a community emergency response team. And what about building stronger community connections? How does that network help build real, lasting readiness?
That's definitely something to mull over. How do we build that deeper layer of resilience beyond the kit and the basic plan?
Food for thought. We hope you'll join us for our next deep dive.